Hello, I'm Dr. Adriano de Santo, and I'm one of the partners here at King Ritson Dental Clinic. Today I want to talk to you a bit about wisdom teeth and extractions. One of the most common questions people ask me is, do I have wisdom teeth or do they need to be removed? And oftentimes it seems like a simple question, but the answer is not always that simple. So what we do at that point is an intraoral examination, which entails us taking a look at the tissues, taking a look at the teeth, as well as taking some diagnostic imaging, which can include a panoramic radiograph, as well as a 3D scan. This enables us to see the position of the teeth, see if there's any potential problems. The most common problems people will have are infection or decay. If we're looking at the radiographs, sometimes we can see other issues such as a cyst that's forming. Also, we can see that the position of the wisdom tooth, if the wisdom tooth is in a poor position, then that may be of concern as well. At the same time, we can also assess where the nerve is. If the wisdom tooth is in proximity to the nerve, then that becomes a concern. But again, having all this information at our hands enables us to sort of minimize those risks for the procedure itself. So not everyone develops all four wisdom teeth. The number does vary and the size as well. The information that we gather in the exam, as well as the diagnostic imaging, will enable us to determine if there's going to be a potential issue. So if we foresee a potential issue, then we may consider removing the wisdom teeth electively. By considering their removal when they're not fully erupted or fully developed, does make the procedure much easier for the patient, and at the same time does minimize the risks and the complications. The procedure itself can be quite straightforward. Sometimes it can be a bit more complicated. We do offer different forms of sedation if it's something that someone feels they need to take the edge off and make them feel a little bit more at ease with the procedure. Another question people will ask is, post-operatively, what can I expect? And again, this depends on the procedure itself, depending on the position of the wisdom teeth, how complicated the procedure is. Post-operatively, there may be some discomfort, there may be some swelling, and even some bleeding, but these are all things that are easily managed, and we make sure you leave our office with a full set of instructions to make sure that you can handle these at home and feel comfortable that you're not going to be running into any serious problems. Yeah. And oftentimes people will ask, do I have to take time off work? More often than not, we will recommend taking anywhere from 2 to 3 days off, just to allow yourself to heal. It can be a bit uncomfortable, and if you are taking pain medication, it's probably wise not to be operating any heavy machinery or doing anything too strenuous. Healing will take place a lot faster if you're taking it easy and relaxing for those few days after the procedure itself. If you want to know more about wisdom teeth or you want to know more about extractions, please feel free to contact our office. We are open 7 days a week, or visit our website, krdental.com. We've got several videos and a lot of information on wisdom teeth extractions and various other dental procedures.